Hi, Dr. Alina Kolchitsky, physical therapist, lifestyle medicine practitioner, nutrition, Pilates, fitness, and more. Today I'm talking about lifestyle medicine in specific. What is lifestyle medicine? Well, it's a medical practice by certified practitioners who have studied and passed the board exam for the American Board of Lifestyle Medicine to guide people in the pillars of health that help prevent or reverse chronic disease. When applied rigorously, they can actually have been shown to reverse these lifestyle practices when incorporated, reverse chronic disease. The types of chronic diseases we're talking about, which is not limited to, but include type 2 diabetes, hypertension or high blood pressure, obesity, insulin sensitivity, all the things related to those, cardiovascular disease, just to name a few. So basically, there are 6 major pillars of health. These are epigenetic factors. So what we mean by that are factors that are outside of our gene programming for health. So of course, we have a genetic code that we're born with, that we inherit from our mother and father, to make us vulnerable to diseases or give us robust or give us health. So those genes, however, with studies have been shown not to necessarily have to be switched on. So our environmental factors around us, things external to our genetic code, can trigger a gene to express or to turn the gene off to not express. So it goes in both directions. So basically, these 6 pillars of health and the practices within them can help you to either turn the gene on to express disease or to express health, or the opposite is true as well. What you eat and don't do, exercise or what have you, or using toxic substances or abusing those can turn a gene on for disease. So the pillars of health include nutrition, food from a whole food, plant-based practice or approach is the best way to promote health and avoid chronic disease. So what do I mean by whole food and plant-based? That means foods that come not so much in a processed package, but in their more raw, natural form. So they are not processed or minimally processed, and they're predominantly from plants. And the plants that we can include are vegetables, fruits, whole grains. So we're not talking white rice and pastas, we're talking brown rice, quinoa, amaranth, couscous, and so on. These types of grains that are in their intact form and have not been processed or minimally processed because they've been taken out of their stock or what have you and put in a package. So that is some processing, but it's minimal, right? As opposed to refined grains, which have been milled and turned into flours to make your breads, pastas, cookies, crackers, etc., and cereals, refined cereals. Those are processed foods that you want to minimize or avoid. So again, our whole food plants include minimally processed vegetables, fruits, grains, and nuts and seeds, and legumes. Legumes refer to beans of all kinds, pinto, black, katuki, you name it. There's fava, there's a million types of beans out there, and lentils, right? And then our nuts and seeds. When you're eating nuts and seeds, they should be in their raw form, as in not processed by roasting or adding flavor and color, but just their natural, raw, organic form. So that's what we mean by whole food, plant-based diet. Most of your food should be in that form. It's okay to have a smattering of animal products in the form of yogurt, whole eggs. If they're, if these products are more organic and natural in terms of how they're raised, the animals that produce them. But avoidance of red meat completely definitely is advisable, and fish and seafood questionable, especially if it comes to cholesterol. So that being said, that's what we're talking about from nutrition point of view. And the other pillar of health is exercise. The more we move, we know our health can be improved for many different reasons. I have lots of videos here in your, I'd like you to use it as a manual, user manual for your body to help take care of each individual joint, maintain mobility and strength so that joint can function optimally. And then I have my programs for overall fitness. And if you're a beginner, you can start with Fundamentals A, progress yourself through Fundamentals B, and then to the second and third program, which are more progressive and challenging. Also, pillars of health include stress, how to deal with chronic stress or avoid chronic stress, and cope with excessive stress or try to reduce it, whichever ways possible, or all of the above. So again, I have some videos about that topic. There's 4 of them you can check out, including positive psychology, mindfulness practices, a simple one just about physiological sigh and how that can immediately impact your nervous system in a positive way to reduce stress when out and about in the moment of experiencing stress. So please check out those videos. Another pillar of health is sleep, getting enough quantity but also quality of sleep so that our sleep is actually restorative. So that means getting sufficient amount of REM and deep sleep where our body repairs itself. We do need light sleep as well, but we need sufficient amounts of all of those types of brainwave activity when we sleep. So check out my videos on that subject. Also, we need to think about positive social connection. We are not meant to live in isolation. When we do, we get all kinds of problems from anxiety, depression, panic, mental health, emotional health diminish when we live more isolated. So it is important to cultivate relationships that help us feel happiness and joy and take us out of, being focused on our problems and to not perseverate on our problems. So positive social connection can allow for healing and emotional and mental wellness, and the lack of can lead to disease, literally. So we've got nutrition, exercise or physical activity, the right kinds, not too much, not too little. We need our avoidance of toxic substances, so that's alcohol, minimize or avoid, and smoking tobacco products. Smoking anything is not going to be good for your lungs, so I would recommend avoid smoking anything. Vaping is just as bad, if not worse, when it comes to addiction. So avoid tobacco products of all kinds. There's a time when tobacco gums might be, or nicotine gums, could be beneficial to help deal with the addiction to tobacco, but that should be done under the guidance of a medical practitioner or someone trained in that, so that you're not actually feeding your addiction, because that happens where people use nicotine products thinking that they're using them to get off of tobacco, but they end up using them in tandem or just as much, if not more. So be careful with that one. Alcohol, also not so healthy for you. So be careful with how much and when and how you drink it. And I have videos about that as well. So whole food plant-based diet, activity, regular activity, built in throughout the day, not necessarily excessive strenuous activity, avoidance of toxic substances, managing stress in a healthy way, getting adequate sleep and the type of sleep also, and lastly, positive social connection. Those are the 6 pillars of health. That's what lifestyle medicine is all about. And this is an area of practice that was cultivated by a number of physicians in the United States who are concerned about the health care that we receive today being more sick care in model rather than health care and prevention of illness. And so this certification program for lifestyle medicine has been supported by decades of evidence on all of those 6 pillars that I mentioned. So everything that I share with you are based on my study and a certification with lifestyle medicine. I'm sharing with you these things as something to help you. Use it as a guide and something of interest. This is not for you to take as a treatment. Do seek, if you need treatment, direct treatment with a medical practitioner or healthcare practitioner trained in the topic of need. Do not self-diagnose or self-treat or use my videos as self-treatment. These are just to help improve awareness so that you can live a healthier lifestyle. Enjoy these videos. They are for subscription, but I do have lots that are for free. So enjoy the free ones and then think about subscribing so that you can have a more informed and robust approach to your health and wellness, hopefully living to your optimal function and increasing your health span, not just necessarily your lifespan, meaning that you're able to do the things you enjoy and love and need and want to do well, with ease and less pain or discomfort. That's all for now. Thank you so much, and please consider subscribing and checking out my other videos. Thank you.